1 in 6 Americans have no health insurance. At any given time during the year, that number will be 1 in 3. 1 in 3 Americans will be without health coverage at some time during the course of the year. And as I'm sure there are some people in this audience who can identify with this, there are a lot of people who have health insurance until they really need it. They file a claim and they're told whatever it is not covered. So we have that. So you've got the exploding cost and no coverage. Now, interestingly enough, here we are. This is the only area of our national life where we call ourselves a cannot-do country. Every other area, we're the can-do country. You'd admit that, right? That's why people still flock to our shores with all of our trouble, and people get mad at it. Everybody still wants to come here. President Kennedy once said, "Freedom has many difficulties, and our democracy is far from perfect. But we never had to put up a wall to keep our people." And people still want to come here. Why? Because it's a can-do country. Except in healthcare, where we say, "I'm sorry, we're a can't-do country. We can't figure out how to insure everybody." Every other rich country has it, but we can't do it. The insurance companies won't let us, or the drug companies won't let us. Sometimes it's pitiful. I'm tired of hearing it. Aren't you? Yeah. The truth is, there are a lot of people who didn't much want to do this before when we tried or died to do it. So here's how her plan works. Number one, everybody must have health insurance. And here's how you get it. If you like what you got, you simply keep it. If you want, you can buy into a plan just like the one that insures all the federal employees and members of Congress and their families. It has lots of choices, but it still has fairly low administrative costs because there's so many people in it. And no one can be denied coverage because of a prior physical or emotional problem. Everybody's insured. No one can be denied. Or if you want, you have another choice. You can buy into a plan that works like Medicare, which might have slightly fewer choices, but would have even lower administrative overhead and might serve your needs better. So you have those choices. Second thing is, if you cannot afford the premium, you are eligible for refundable tax credits to make sure you can afford the premium. And thirdly, if your employer, a small business, let's say, wants to help with an employer portion of the premium and they can't afford it, they are also eligible for refundable tax credits. So that up and down the income line on the business side and on the personal side, everybody can buy into the system. But it's quite important that everyone carry insurance because otherwise it's going to be very hard to slow the cost of inflation because let's say you are 18 and you're convinced or you're going to live forever, but if you get in an accident, you go to the emergency room, that's a very high cost thing. Those costs automatically get spread to everybody else. So it's important that everybody has some form of basic insurance, and this makes it affordable, and it's all paid for by allowing the tax cuts on the highest incomes of Americans, including me, which I strongly support, to lapse. So we should pay our fair share. And also affecting certain economies in the current healthcare system. So first, universal coverage. Second part of the plan is to improve the way we deliver health care in America to get better outcomes at lower cost. And whenever Hillary or I or anyone else says this, some cynic will lower roll their eyes and say, "Oh, there they go again. Nobody can possibly insure more people and restrain the cost." Again, that's the can't-do crowd telling you that. Look at every other country in the world. If you took any country's healthcare system and dropped it in America, Japan's, Germany's, and you just go pick one. Dropped it in America, it would cover everyone and cost you $700 billion less than we spend today. It would cover everyone, give you better outcomes, and cost $700 billion less. There was actually a great study done last year by, or maybe earlier this year, by McKinsey & Company analyzing exactly where the money goes. What's the difference in where's the $700 billion? But for purposes of today, most of it is in the way we deliver health care. That is, you get paid if you're a health care provider by how many people you see, how many procedures or tests you do. Not by how comprehensively and efficiently you treat the whole person. Nobody else does that anywhere in the world. And the places that don't do that in America provide high-quality health care at lower cost. The Mayo Clinic, for example. Hillary went to the Mayo Clinic and talked to doctors there and doctors in the surrounding area, and the doctors who did not practice there said, if we organize health care like they do, where you show up and they just figure out what is the condition of your health care, what do you need, how can you prevent further problems, and you manage that in a comprehensive way, that we could cut health care costs in America 20% and improve the quality of health outcomes. So there's a lot of incentives for us to move to that in her plan. Let me just give you the easiest one to understand and one to identify with. If we had electronic medical records for everybody, so that if you showed up to any new place, an emergency room or a new doctor's office or whatever, there are privacy protections. You gave permission to look at your medical records. That would save, at its most conservative estimate, $80 billion a year. That's 80% of what it would cost us to insure every man, woman, and child. And if you just think about your own experience, if you reach a certain age, it won't surprise you. I mean, come on, everybody here over 40. How many times have you showed up at a new doctor's office, and before you can get the first pill, the first examination, you have to sit there and answer 5 pages of questions about your medical history, which you have already answered 15 times in your life. And as you get older, it gets harder to remember the right answer. But they have to ask, and you have to answer, otherwise they're liable if they give you an aspirin. So we go through this enormous charade and add fabulous cost to the system. This happened a couple years ago. I had to have this little dental procedure, and Hillary said to me, Bill, you've got to go to my dentist. He's better at this. And, you know, I knew she was right, but I dreaded, like she normally is about stuff like this, but I kind of dreaded having to do this. Because I knew, and sure enough, I showed up, and the dentist sat down. He was a really nice, intelligent guy. He did a fabulous job for me. I can't say enough nice things about him, except I had to spend the first hour answering these questions. And I wanted to scream at him, I was president and governor. I had very good medical records. I am 60 years old. I do not remember the answer to half these questions. You've all been there, haven't you? Meanwhile, I'm piling costs onto you, onto the American healthcare system. So, if you just did the electronic medical records, in time saved and unnecessary procedures avoided, it would save 80% of where we need to go to cover everybody. That's just one example. So her plan does, first, covers everybody. Second, has incentives to change the way we deliver health care so we improve quality and cut costs. And third, maybe most important of all, promotes wellness as well as treats sickness. Now, we are great at treating people when they're really sick in America. I'm an exhibit A of that, right? I had all this heart trouble. So if we weren't good at that, Christy would have had to introduce someone else today. I wouldn't be here giving you this speech and looking forward to celebrating another Christmas. But we're not very good at staying well and promoting wellness, and we don't have enough incentives in our system to do that. And it's a huge problem when we're trying to avoid, as I said earlier, this epidemic rise of diabetes among our young people, and when we're about to see the retirement of the baby boomers. Now, all of you should care about that, no matter how young you are, because the baby boomers are the largest group of Americans until the current group of kids in public school. They're bigger. But they're the first that are bigger. And if you get to be 65 in America, you enter the only category in which we rank first in healthcare. That is, we do have the oldest senior population on earth. So if you can cross that great divide to 65, you're in the group that lives the longest.